Hello guys, good afternoon. I welcome you all on Unacademy, India's largest learning platform. Today we are going to study about this high altitude deep sea physiology. So first coming to the introduction, myself Dr. Nidhi, I'm your physiology educator at Unacademy. This is my page on Unacademy, that is unacademy.com/KGMC. Follow me out there so that you will get notification of any upcoming classes of mine on Unacademy app. This is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this to get additional 10% off. I've taken many plus classes, many special classes, so anytime you can join and revise your topic. Now coming to the subscription. First is the plus subscription. What all are the benefit if you want to access this plus subscription? You will be able to access both the live and recorded session. If by chance you miss any session, you can see this recorded version. You have an opportunity to learn from India's top educator for the medical examination. We always conduct this live test and live quizzes. From that, you can analyze your preparation at any point of time. You have a flexibility. You can study on the device of your choice. We have a question bank which consists of 25,000 plus questions. These questions are high yield, clinical based, and this is with explanation. So काफी ज़्यादा beneficial होने वाला है आप सभी के लिए. Next is the iconic subscription where you get access of India's two best platform, that is our Unacademy, the Prep Ladder. So you are going to get all the plus benefit. Like I said, live classes, recorded classes, question bank, live tests, live quizzes, and the PDF. Along with that, you get access for this Prep Ladder. In this, you can access the clinical and integrated essential of Prep Ladder, video lecture from the Dream Team, Question Bank 3.0 with active guidance, rapid revision and snapshot, and you will also be provided with their treasure and dream notes. So if you're looking for subscription that include both, go for the iconic subscription. Next special class is also free of cost, but they are way more special because they are always and always live interactive sessions are there. Polls feature are there by which class is very engaging. Raise your hand feature is there. Now you can talk to educator in the live session. If you follow any educator, you will get notification of their classes. After the lecture, you can download the PDF and revise it anytime, anywhere. Important announcement, we are going with this Unlock 20. So if you are looking for the subscription, do enroll yourself right now because sare subscription pay 20% off at till 30th June. But do remember the code you have to apply for this one is Dr. Nidhi. Next, we are started with this batch, that is Target NEET PG 23 batch. This whole duration is a 9 month. It consists of two modules, module 1 and module 2. In module 1, we are going to have subject-wise batch, and in module 2, we are going to have a high-yield revision. Next, we are just also started the batch for the repeater, that is test and discussion batch. So as per your requirement, you can take your subscription and start your preparation right now. One more important announcement, iconic subscription price hikes is going to be very soon. So if you are looking for subscription that include both, you should go right now because coming soon में काफी ज़्यादा price hike होगा. तो अपने आप को आप save कर सकते हो. By using this code, you will get additional 10% off. Now coming to the topic, today we are going to study about this high altitude physiology. क्या क्या हमारे body में physiological changes होता है when we reaches to this high altitude. So first, why the human ascends for the high altitude? He ascends for either the aviation, mountain climbing or the trekking, or the space exploration. In three situations, where human normally ascends to high altitude. And what happened at high altitude, basically, the composition of air remains same. Means at this level, at our levels, the composition consists of 21% oxygen. So at a high altitude also, the oxygen is 21%. But at high altitude, the barometric pressure falls. Why this falls? Suppose our pressure at this level is 1 atmospheric, that is 760 mm of Hg. So the barometric pressure will be below this one at a high altitude. So what happened? We all know partial pressure of oxygen is equal to fractional concentration of oxygen into barometric pressure. So since barometric pressure falls down, the partial pressure of oxygen is going to decrease and that lead to the hypoxia. And that is the problematic situation that is going to cause all the physiological changes in our body. So what happened? Next terminology is acclimatization. This is the change in our body, the physiological change in our body to tackle that hypoxia when we are exposed to long term of this hypoxia situation. That is known as acclimatization. Okay, the physiological adaptation which is occurring at high altitude is our acclimatization. So moving further, what all occur in our acclimatization? First, what happened? There is increase in the pulmonary ventilation. So what happened at the high altitude due to hypoxia? The chemoreceptor is stimulated. Which chemoreceptor is stimulated? Anybody? Our peripheral chemoreceptor is stimulated. Okay, and due to that, what happened? Chemo reflex is there. So alveolar ventilation is going to increase. So since alveolar ventilation is increased, there will be carbon dioxide washout. So finally, the partial pressure of carbon dioxide is going to decrease. And since partial pressure of carbon dioxide decreases, the carbonic acid form is going to decrease. So it is going to cause this respiratory alkalosis. So what happened due to this respiratory alkalosis? Due to increase in pH, we all know our calcium is usually bind with this albumin. But when the pH is low, hydrogen ion is going to bind with this albumin. So free albumin will be there. Okay, but out here क्या है? हमारा hydrogen ion is less. So our albumin is more. ठीक है, so calcium is going and bind with this albumin. So out here the free calcium will be less. So protein bound calcium इस situation में increase हो जाएगा, free calcium decrease हो जाएगा, and that is going to cause this hypocalcemic tetany. Is this point clear with everybody? Why increase in pH is going to decrease the free calcium level? Everyone. Normally hydrogen ion binds with the albumin, इसलिए free albumin कम होगा, तो कैल्शियम हमारा एल्ब्यूमिन से बाइंड नहीं हो पाता और फ्री कैल्शियम ज्यादा होता है. ठीक है, बट ड्यू टू एल्कलोसिस सिचुएशन हाइड्रोजन आयन इज लेस, सो देयर विल बी लेसर बाइंडिंग ऑफ दिस हाइड्रोजन विद दिस एल्ब्यूमिन. सो हमारे पास एल्ब्यूमिन अबंडेंट में, सो आवर कैल्शियम गो एंड बाइंड विद दिस एल्ब्यूमिन. सो दैट्स व्हाई द फ्री कैल्शियम इज डिक्रीज्ड. इज दिस क्लियर विद एवरीबॉडी? Do reply fast, everyone. Is this clear? Shall we move further? Okay, then moving further. Next, what happened? Due to increase in this pH, kidney will start to compensate. How kidneys compensate the alkalosis situation? Anybody? Kidney start to excrete this bicarbonate ion, and kidneys start to conserve the hydrogen ion. And due to this, what happened? Our blood and CFS is going to be acidic, and that further stimulate the ventilation. Okay, ventilation stimulate होगा, तो same thing, carbon dioxide washout होगा. It is also again going to cause respiratory alkalosis. So same vicious cycle is going to happen. Is this clear with everybody? So next thing what occur in high altitude is there is increase in number of RBC. Okay, what happened due to hypoxia? Our erythropoietin from the kidney is going to increase. So what does this erythropoietin do? It is going to increase the RBC count. And next, another factor which is responsible for this increase in RBC is hypoxia inducible factor, separates from this von Hippel-Lindau protein. This is our von Hippel-Lindau protein. Okay, so in normoxia situation, what happened? In normoxia, this hypoxia inducible factor combined with this von Hippel-Lindau protein, and this combination undergo the degradation process. While in hypoxia situation, this hypoxia inducible factor separate from von Hippel-Lindau protein, and this act like a transcription factor for erythropoiesis. So RBC production is going to increase. Okay, next thing what happened in high altitude, there is increase in the vascularity of peripheral tissue. How it occur? Because of hypoxia, what happened? There is release of this vascular endothelial growth factor, and that promote angiogenesis, that promote new vessels formation. So that's why vascularity of any tissue is going to be increased. Is this clear? Next thing what happened, diffusion capacity of lung also increases. So angiogenesis occur in our lung also. So what happened, the pulmonary capillary is going to increase. So more the pulmonary capillary, more will be the surface area for the diffusion. So that's why diffusion capacity of lung increases in hypoxia situation. Okay, next thing, at the cellular level, there is increased ability of a tissue to use oxygen despite of a low partial pressure of oxygen, and this phenomena is known as cellular acclimatization. Okay, and why the cellular acclimatization is there? How a tissue is going to use more oxygen despite of hypoxia? Because of increase in mitochondrial enzyme as well as mitochondrial number. So that's why tissue is able to use the higher amount of oxygen despite of hypoxia, and this phenomena is known as cellular acclimatization. Is this clear with everyone? Do reply fast. Is this clear? What all changes are occurring, everybody? Ventilation increases, erythropoiesis increases, oxygen utilization by the tissue increases, angiogenesis occurs, vascularity of peripheral tissue increases. So these all happen due to hypoxia. So moving further, what happened on the circulation? What happened on the circulatory system? Because of hypoxia, what happened? There is an increased sympathetic activity, and due to that, the blood pressure increases, heart rate increases, and the cardiac output also increases. And next important point is, due to hypoxia, pulmonary vasoconstriction occur. Do remember this point. This is very important. Due to hypoxia, in all other organs except our lung, what happened? Due to hypoxia, the vasodilation occur. But in lung, the vasoconstriction, out here the vasodilation occur. But in our lungs, the vasoconstriction occur. And this vasoconstriction is going to cause a pulmonary hypertension. Now the point is, why the pulmonary vasoconstriction is there? Because see, same thing is written out here ना, hypoxia की वजह से other organ में vasodilation होता है, but in lung the vasoconstriction occur. Why is it so? Because in lung we have this oxygen sensitive channel in our smooth muscle of pulmonary artery. So this is sensitive to the hypoxia. So whenever there is hypoxia, this channel get closed, and due to the closure, क्या होगा? Potassium efflux is going to stop. Potassium will accumulate inside the cell. Since positive ion is accumulating inside the cell, membranal negativity is going to decrease, and that is known as a depolarization. And the membrane, when the membrane potential reaches the minus 40 millivolt, this voltage gated a calcium channel opener. This is going to cause a contraction because they bind with this troponin C. Troponin tropomyosin complex will move away, and that is leading to the contraction of cell or the vasoconstriction. Now, the significance part of this vasoconstriction. What is the significance of this vasoconstriction in lung? Due to this vasoconstriction, what happened? Blood flow is directed towards the better ventilated alveoli. जहाँ पे ऑक्सीजन का कंसंट्रेशन प्रॉपर होगा, वहाँ पे ब्लड फ्लो इज रीडायरेक्टेड. Okay, good afternoon, Dr. Apur. So next on the OHDC, on due to respiratory alkalosis. Alkalosis में हमारा OHDC कहाँ शिफ्ट करता है? It shift towards left. But what happened? क्योंकि हमारा जो OHDC high altitude है, वहाँ पे oxygen is less. So in absence of oxygen, हमारा जो पाथवे यूज होगा वो एनारोबिक पाथवे होगा. एनारोबिक पाथवे का इंटरमीडिएट प्रोडक्ट है हमारा 2,3-diphosphoglycerate. So later on, due to accumulation of this 2,3-diphosphoglycerate, our OHDC curve shift towards the right. So we can say the dual shift of OHDC occurs. Is this clear? The dual shift of OHDC curve occur in high altitude. So now next is the high altitude related disease. It consists of acute mountain sickness, high altitude cerebral edema, high altitude pulmonary edema, and the chronic mountain sickness, which is also known as Monge's disease. Okay, in this what happened, these three are the acute form, only and only this one is the chronic form. This acute mountain sickness is the mild form, while this high altitude cerebral edema as well as high altitude pulmonary edema is the severe form of the disease that is caused by this high altitude. So now coming to the detail of each one. First coming to the acute mountain sickness, AMS. It develops in 8 to 24 hours after reaching the altitude, and it lasts for 6 to 8 days. And the most important feature is headache. Headache in the recent gain of altitude is the characteristic feature of this acute mountain sickness. Mild to moderate form of this acute mountain sickness will show these symptoms: hypoventilation, interstitial edema, and the increased sympathetic drive is there. While the severe form can lead to the white matter edema due to increase in intravascular pressure. We will discuss this one. So now moving to the next, that is the high altitude cerebral edema. This high altitude cerebral edema is characterized by acute mountain sickness syndromes. इसमें क्या था हमारा हेडेक था. हेडेक characteristic feature यहाँ पे भी होगा headache, but along with the headache the ataxia will be seen. What do you mean by this ataxia? Anybody? Anyone? What do you mean by this ataxia? Loss of postural control is known as ataxia. So in high altitude cerebral edema, we will see these two characteristic features, that is headache plus a loss of postural control will be seen. Along with that, mental status change will also be seen. Now coming to the why this cerebral edema occurs at high altitude. Because in brain, due to high altitude, the vasodilation occurs. And due to vasodilation, क्या होगा हमारा? Cerebral blood flow is going to increase. Cerebral blood volume is going to increase. And due to that क्या हुआ हमारा जो cerebral में auto regulation होता है, that is impaired and our brain will be over perfused. And due to that क्या होगा? Capillary pressure increase होगा, that is going to damage the basement membrane. And उसकी वजह से हमारा जो plasma है that extravasate, and that is going to lead this vasogenic edema or high altitude cerebral edema. ठीक है, हाइपोक्सिया की वजह से सब जगह वेजोडाइलेशन होता है, तो ब्रेन में भी वेजोडाइलेशन होगा, and that is going to cause increased cerebral blood flow. Over perfusion will be there, that is going to elevate the capillary pressure. Capillary wall will be damaged, and that is going to lead the extravasation of plasma, and that is going to cause the edema. Now coming to the treatment part. All symptoms are occurring due to high altitude, so we should immediately descend to the lower altitude in this situation. All things are occurring due to oxygen concentration decreasing, so we can administer this oxygen. And since edema is there, we can give this dexamethasone. Okay, so this is the treatment line for this high altitude cerebral edema. Everybody, is this clear? Do reply fast, everyone. Shall we move further? Why this high altitude cerebral edema is there? What is the treatment line? Is this clear with everybody? Okay, then moving further to the next part, that is high altitude pulmonary edema. Most important point, this high altitude pulmonary edema occur within 2 to 4 days of ascent, or you can say most commonly it is occurring at the second night of ascent. ओके, ट्रीटमेंट लाइन बाद में डिस्कस करते हैं, पहले हम फिजियोलॉजिकल पार्ट देखते हैं, हाउ दिस एडिमा अकर एट हाई एल्टीट्यूड. सो alveolar hypoxia is there. So due to that, we studied there is a vasoconstriction in our pulmonary artery due to presence of that oxygen sensitive potassium channel. ठीक है, vasoconstriction की वजह से क्या हो गया, uneven और patchy distribution हो गया. The significance part was हमारा जो ब्लड फ्लो है वो डायरेक्ट होता है बेटर वेंटिलेटेड एल्वेलाई में. सो बेटर वेंटिलेटेड एल्वेलाई में प्रेशर क्या हो जाएगा, इंक्रीज हो जाएगा, and that is going to damage the capillary wall of that better and ventilated alveoli. So capillary wall leak kar jayegi, and that is going to cause this high altitude pulmonary edema. So ab baat karenge treatment line ki. So we should immediately descend to the lower altitude. Administration of oxygen will also help. And the last thing out here is this vasoconstriction is causing the problem na. So this vasoconstriction is due to oxygen sensitive channel. What does this oxygen sensitive potassium channel do? It closes up, and due to closing, what happened, the potassium efflux is going to stop, and that causes the depolarization. And due to depolarization, हमारा क्या होता है, calcium channel open up, calcium influx is there, and that is going to cause vasoconstriction. So if we give the drug that is going to block this calcium channel, the vasoconstriction will not occur. So that's why we give this calcium channel blocker like nifedipines. So this is the treatment line. Is this clear with everybody? Coming to the last one, that is a chronic form of this disease, which is known as chronic mountain sickness. It is also known as a Monge's disease. ये उन पेशेंट्स में मिलता है जो काफी टाइम से बाहर रह रहे हैं, हाई एल्टीट्यूड पे रह रहे हैं, दैट इज अबव 2500 मीटर. इसमें हमें क्या क्या कैरेक्टरिस्टिक फीचर मिलेगा, एक्सेसिव एरिथ्रोसाइटोसिस, पल्मोनरी वासोकंस्ट्रिक्शन की वजह से पल्मोनरी हाइपरटेंशन विल बी सीन, cor pulmonale will be seen. What do you mean by this cor pulmonale? Anybody? Anyone? What do you mean by this cor pulmonale? Anyone? What do you mean by this cor pulmonale? Cor pulmonale is the right heart failure due to lung is known as cor pulmonale. ठीक है, यहाँ पे पल्मोनरी हाइपरटेंशन है, उसकी वजह से राइट हार्ट फेलियर होगा, एंड दैट इज नोन एज द cor pulmonale. Everybody, is this clear? Yeah, very true, Dr. Asifa. Morphine is going to release some symptomatic treatment के लिए दे सकते हैं, but जो actual treatment होगा वो हमारा by the calcium channel blocker होगा, that is nifedipines. Is this clear? Is this clear, Dr. Asifa? Coming to the question part of this high altitude questions. Which of the following is seen in high altitude? Hyperventilation, decreased partial pressure of carbon dioxide, pulmonary edema, hypertension, bradycardia. It consists of basically multiple answers, so see each and every option very correctly. Yeah, very true. We will see this pulmonary edema. Next, any other option? Which of the following is seen in high altitude climbers? Due to hypoxia, our respiratory system will be stimulated. It is going to cause hypoventilation. ठीक है, अभी just पढ़ा था pulmonary edema, cerebral edema का. Due to hypoxia, sympathetic drive is there, so blood pressure increases, heart rate increases. So tachycardia is there, but not the bradycardia. So answer is A, C, and D. No, bradycardia is not there. We will get this tachycardia. Coming to the next one. A 32-year-old high-altitude mountaineer is observed to have hematocrit of 70%. Which of the following represent the most likely cause or explanation? Polycythemia with increased red cell mass, relative polycythemia due to dehydration, polycythemia due to hemoconcentration, polycythemia with high-altitude pulmonary edema. Is this clear? चलो आंसर करो. No, due to hypoxia हमारे में क्या होगा? Sympathetic drive will be there, and that is going to cause increase in blood pressure, increase in heart rate, increase in cardiac contractility, increase in cardiac relaxation. So all these are occurring due to sympathetic drive that is occurring due to this hypoxia. Intracranial pressure is going to have a secondary effect on that. Yeah, polycythemia due to increased RBC is the cause of increased hematocrit in this situation. Coming to the next, in a high altitude mountain sickness, the feature of edema is decreased pulmonary capillary permeability, increased pulmonary capillary pressure, normal left atrial pressure, increased left ventricular back pressure. Chalo, everybody answer this question. In high altitude mountain sickness, the feature of pulmonary edema is everybody answer this question fast. Yeah, very true. In high altitude sickness, feature of edema is increased pulmonary capillary pressure. ठीक है, ड्यू टू हमारा अनइवन और पैची डिस्ट्रीब्यूशन की वजह से सम एल्वेलाई में क्या होगा? कैपिलरी प्रेशर इज गोइंग टू इंक्रीज and that lead to the damage and that lead to the our pulmonary edema. Coming to the next one. In a mountaineer ascend to 18,000 feet in 2 days without supplemental oxygen. At the height of ascent, the changes are increased partial pressure of carbon dioxide, decreased barometric pressure, decreased inspired oxygen, decreased partial pressure of oxygen, increased pH. A mountaineer ascend to 18,000 feet in 2 days without supplemental oxygen. At the height of ascent, the changes are C, D, and E. At high altitude, the barometric pressure falls. Okay. Barometric pressure जैसे ही fall करेगा, partial pressure of oxygen is going to decrease. pH ड्यू टू हमारा वेंटिलेशन इंक्रीज होगा तो हमारे इसकी वजह से क्या होता है, कार्बन डाइऑक्साइड वॉश आउट होता है, दैट इज गोइंग टू कॉज रेस्पिरेटरी अल्कलोसिस. So this is true. Inspired oxygen is going to remain same, that is a 21% reach to our lung. Answer is B, D, and E. Is this clear? Coming to the next one. During acclimatization to high altitude, all of the following are seen except A. Option A, increase in minute ventilation, increase in sensitivity of a central chemoreceptor, increase in sensitivity of carotid body to hypoxia, shift of OHDC towards the left. During acclimatization to high altitude, all of the following take place except no, the percentage composition of oxygen remains same. So answer this question. During acclimatization to high altitude, all of the following take place except minute ventilation increases, हमारा respiratory rate increase होगा तो minute ventilation हो, alveolar ventilation हो, दोनों ही increase करेगा. हमारा hypoxia की वजह से central chemoreceptor stimulate होगा, carotid body peripheral chemoreceptor है ना, तो वो भी stimulate होगा hypoxia की वजह से. ठीक है. Shift of OHDC towards the right as well as the left, both occur. Dual shift is there, not only to the left. So answer is D. Is this clear? Coming to the next one. A person goes to a mountain. When he reaches to 5,000 feet, he developed dyspnea. Which of the following correctly explain for the symptom? CNS depression, carbon dioxide washout, increased work of breathing, increased blood flow to the pulmonary tissue. No, dyspnea occur due to carbon dioxide washout because of this carbon dioxide respiratory alkalosis occur, and due to that what happened? Due to what happened, our kidney will start to work, kidney will start to excrete this bicarbonate, kidney will start to conserve hydrogen, and that is again going to cause the acidic nature of the CSF and blood, and due to that what happened, again respiratory center is stimulated, again the hypoventilation start, and that is going to cause this dyspnea. So answer is B. Is this clear with everybody? Coming to the next one. Which of the following adaptation will be apt to increase the work capacity at a high altitude? Increasing workload, decreasing duration of exercise, increasing workload, increasing duration of exercise, decreasing workload, increasing duration of exercise, decreasing workload, decreasing duration of exercise. No, difficulty in breathing is there, and that is not going to cause this hyperventilation. Hypoventilation is void. The hypoventilation occurred due to decrease in this oxygen concentration, partial pressure of oxygen. There is a stimulation of our chemoreceptor. Our peripherally chemoreceptor will be stimulated, and that is going to cause this chemoreflex. And what is this chemoreflex? Chemoreflex is increase in ventilation will be seen. And due to that, what happened? The respiratory alkalosis occurred, and that causes activation of our kidney will start to conserve hydrogen ion, and that lead to the acidic pH of that one. Okay, is this clear? Is this clear, Dr. Asifa? No, we cannot increase the work capacity at high altitude by increasing workload. अगर workload भी increase करेंगे तो workload की वजह से भी hypoxia drive होगा. Need of oxygen will increase, so it is going to also drive the hypoxia. ठीक है, तो हम सबसे बेस्ट वे क्या हो सकता है? वर्कलोड को तो हम डिक्रीज रखें, बट ड्यूरेशन इंक्रीज कर ले, तो हाइपोक्सिया ड्राइव ड्यू टू दिस वन, ड्यू टू वर्कलोड इज नॉट गोइंग टू बी अफेक्टेड. Okay, so answer is C, not A, not B. Is this clear? अगर प्लेन्स की बात करेंगे तो हम वर्कलोड इंक्रीज करके वर्क कैपेसिटी इंक्रीज कर सकते हैं, बट एट द हाई एल्टीट्यूड इफ वी गो फॉर द इंक्रीजिंग वर्कलोड, हाइपोक्सिया ड्राइव इंक्रीज हो जाएगा और उसकी वजह से सिस्टम और भी ज्यादा एग्रोवेट हो जाएगा. इज दिस क्लियर? Coming to the next one. Late effect of mountain climbers are all except hypoventilation, increase erythropoietin, bicarbonate excretion, decrease in the mitochondria. See what happened at high altitude. At high altitude, there is a hypoxia. And if we are going for this one, increasing a workload, it is also going to cause the hypoxia. So better go for the decreasing workload and we can increase the duration. This is the perfect way to increase the work capacity at high altitude. Okay, is this clear, Dr. Apur? चलो हम अपने इस क्वेश्चन पे आते हैं. Answer this question, everybody. Late effect of mountain climbers are all except. Yeah, very true, Dr. Asifa. Mitochondria number increases. Very true, Manasa. Coming to the next one. At high altitude of 13,000 feet, the barometric pressure is 447 mm of Hg. We have to calculate partial pressure of oxygen of that moist air. Everybody calculate this one and answer. Everybody answer this question fast. How come 84? How come 149? Let me calculate this one first of all. Yeah, partial pressure of oxygen is equal to fractional concentration of oxygen FiO2 into barometric pressure. And fractional concentration at high altitude also remains same. That is 21%. That is 0.21. Or barometric pressure given हमारा, it is R447 mm of Hg. So the answer will be 93 mm of Hg. Is this clear with everybody? Do reply fast. Is this clear? Okay, then moving to the next question. At a high altitude of 3000 meter, a person complain of breathlessness. All of the following can be used for the management except oxygen supplementation, immediate rapid descent, acetazolamide, intravenous digoxin is there. All of the following can be used for the management of this person. Yeah, very true. When we give this digoxin, already sympathetic drive है, हमारा heart rate और ये सब increase है, so we cannot give this one. It is not going to help in this one. Is this clear with everybody? Acetazolamide हमारा carbonic anhydrase inhibitor है, so it is going to inhibit the formation of carbonic acid. ठीक है? Coming to the next one. A person unacclimatized developed pulmonary edema in 19 to 20 days, second to third month, 2 to 3 days, or 6 to 7 days. A person unacclimatized developed a pulmonary edema. A person unacclimatized is going to develop edema, and that is going to be in second to third days. Most probably second night में हमें symptoms मिलते हैं. Answer is C. Is this clear with everybody? Coming to the next topic we are going to study is the deep sea physiology. Okay, चलो next topic पढ़ते हैं. Deep sea physiology. What happened at the deep sea? Deep sea में भी हमारा fractional concentration remains in. Out there also percentage of oxygen will remains in, that is 21%. But in the deep sea, what happened? The barometric pressure is going to increase. So what happened? Due to increase in barometric pressure, the partial pressure of the constituent gases is going to increase. And due to that, what happened? Amount of gas that is going to be dissolved in the tissue is going to increase, and that lead to the toxicity of gases. This is the problem at the deep sea. Is this clear with everybody? Is this point clear? Why the toxicity is the problem? Because dissolved oxygen zyada hoga at higher pressure, and that is going to cause the toxicity, and that is the problem. Yeah, let me check the video first of all, why it's stuck. Let me check. There is some technical issue. I'm checking it. Wait a second, everybody. I guess I'm visible. Okay. So what happened at deep sea? The fractional concentration remains same. Only and only what happened, the barometric pressure is increased. Since barometric pressure increases, the partial pressure is going to increase. And since partial pressure is increased, the more amount of oxygen is going to dissolve in the plasma. And that's why it is going to cause the toxicity, which is the problem. So what happened? First coming, why human descent to deep sea? For the recreational activity, for the employment under water construction and the military operation. And at deep sea, we already discussed composition of air remains same, only and only the barometric pressure changes, and that lead to the toxicity. See what happened at the sea level, the pressure volume is 1 liter. हम जैसे जैसे below जाएंगे, pressure is going to increase. Since pressure increases from the Boyle's law, pressure is inversely proportional to the volume. So volume क्या होगा? Decrease होगा. So our gases will be compressed at the deep sea level. And when we further extend to that sea level, उस समय क्या होगा? ये gas हमारी expand करेगी, and that also leads to the problem. So see what happened. First, see this chart. Barometric pressure on deep sea is going to increase, so the volume is going to decrease. Intrathoracic pressure, intraalveolar pressure is going to increase. So what happened? First is the oxygen toxicity. Due to high partial pressure of oxygen, seizures start हो सकते हैं, and it can even lead to the coma. Next, the carbon dioxide toxicity also occurs. When partial pressure of carbon dioxide reaches to the 80 mm of Hg, उस situation में क्या होगा? Minute ventilation is going to increase, and if the diver usually tolerate this one, but when the partial pressure of carbon dioxide reaches beyond 80 mm of Hg, respiratory center will start to begin to depressed. So that is the problem. Next, the most important thing that occur in deep sea physiology is this nitrogen toxicity or nitrogen narcosis. What happened when individual usually descend to the deep sea? Same thing occur. Our partial pressure of nitrogen is going to increase, and that is going to cause a nitrogen toxicity, which is also known as raptures of deep. इसमें जो सिम्टम्स आते हैं सेम आते हैं अल्कोहल इंटॉक्सिकेशंस के. कैसे आते हैं सिम्टम्स देखना. When person reaches to 120 feet below, symptom of joviality is seen. थोड़ा सा elevated mood feel करेगा. And when person reaches to 150 to 200 feet, he start to feel drowsy. 200 to 250 feet पे patient start to feel too clumsy to perform work. And if it goes beyond 200 feet, the person will become almost useless. So same symptoms है alcohol intoxication के. That's why it is also known as this Martin's law. Okay. So see, this nitrogen has higher affinity to the lipids. So it is going to bind with this adipocytes and the neuronal membrane. And since it can cross the blood-brain barrier, it is going to lead this euphoria, overconfidence, and further the deterioration in the judgment will be seen. So these all are the important signs and symptoms we will get in nitrogen narcosis or nitrogen toxicity, which is also known as Martin's law. Is this clear with everybody? Do reply fast. Is this clear? Okay, moving further. Now coming to the decompression sequence, which is also known as Casson's disease, diver paralysis, dysbarism, compressed air sickness, and the bend. ठीक है. When does it occur? When the diver ascend immediately to the sea level. ठीक है. हमने deep sea level में diving किया, and when we ascend rapidly to the sea level, this occur. Why it occur? Because हमारा जब हम deep sea level में पहुंचे थे तो हमारा gases क्या हुआ था? Compressed हुआ था. हमारा gas compress हुआ था. अब जब मैं ascend करेंगे, it is going to expand. So it is going to form the bubbles, and that bubble is going to damage the vessels. They are going to block the vessels, and that lead to this decompression sickness, Casson's disease, diver paralysis, dysbarism, or the bend. Is this clear? So what happened? When he ascended rapidly, nitrogen bubble is going to form, and it is going to cause the minor damage. Gas bubble is going to form, and they are going to block the blood vessels. The major symptoms out here is due to this bubbles going to accumulate around the joints. So they are going to cause a pain in our joint. They are going to pain in our muscles. So that lead to the bending. जैसे पेन होगा वो बेंड करेगा. That's why it is also known as bends. ठीक है? Is this clear? Dizziness, paralysis, or collapse and unconsciousness is seen in 5 to 10% cases. In severe cases, in approximately 2% cases, we will see this choke. But this bend is seen in 85 to 90% of the diver who is coming very rapidly to the sea levels. Now, what happened? Due to massive number of micro bubbles, क्या होगा? Pulmonary capillary plunge कर जाएगी. Shortness of breathing will be there, and due to that क्या होगा? Severe pulmonary edema can occur, and that can even lead to the death. So what is how we are going to prevent this decompression? First and the best method is to staging. ठीक है, थोड़ा सा एक्सटेंड करे, फिर वहीं रुक जाए उसी लेवल पे, फिर थोड़ा सा एक्सटेंड करे, देन वहीं रुक जाए. दिस इज नोन एज स्टेजिंग. नेक्स्ट इज द टैंक डीकम्प्रेशन. अगर फास्टली एसेंड करके अगर सी लेवल पे आ गया डाइवर, तो उसको रिकम्प्रेशन चेंबर में हम पुट करते हैं, एंड इसके अकॉर्डिंगली सेट करते हैं. धीरे धीरे हम इसको नॉर्मल सी लेवल के प्रेशर पे रीच कराते हैं. सो दिस इज द मेथड जिससे हम decompressions को प्रिवेंट कर सकते हैं. Is this clear? Now coming to the space physiology. हमारा ग्रेविटेशनल फोर्स लगता है हमारी बॉडी पे, तो जी फोर्स अगर पॉजिटिव हो तो सिचुएशन अलग हो जाती है, नेगेटिव हो या फिर जीरो या माइक्रो ग्रेविटी उसी को कहते हैं जब हमारा जी फोर्स जीरो हो जाता है, एंड दिस इज नोन एज माइक्रो ग्रेविटी. तो अलग अलग सिचुएशन में हमारी बॉडी अलग अलग तरह से रिस्पॉन्ड करेगी फिजियोलॉजिकली. फर्स्ट कमिंग टू द पॉजिटिव जी. व्हेन पॉजिटिव जी इज देयर तो ग्रेविटेशनल फोर्सेस हमारा कहाँ लग रहा है, डाउन लग रहा है. सो ब्लड विल बी पुश टुवर्ड द लोअर मोस्ट पार्ट ऑफ द बॉडी. सो उसकी वजह से क्या होगा, वीनस पुलिंग ऑफ ब्लड विल बी देयर, सेरेब्रल प्रेशर डिक्रीज होगा, दैट इज गोइंग टू कॉज अनकॉन्शियसनेस. ठीक है, blood that is reaching to our eye also decreases and that lead to the blackout of vision. So these are the symptoms, signs we will get in positive G. When G is the negative, our blood will be pushed towards the head end. उसकी वजह से क्या होगा, venous return increase हो जाएगा, venous pulling is going to decrease, venous return is going to increase, cerebral pressure is going to increase, blood reaching to head and neck is going to increase, blood reaching to eye is going to increase, so it is going to have hyperemia, और उसकी वजह से क्या होगा, red out of vision will be seen. Is this clear with everybody? Blackout कब होगा, जब blood flow to our brain is going to decrease, sorry, to eye is decrease. When blood reaching to eye increases, it is going to cause red out vision. Okay, last is the microgravity. Zero gravity situation में क्या होगा, motion sickness will be there, decrease in blood volume, decrease in RBC mass, decrease in muscle strength, decrease in work capacity, decrease in maximum cardiac output, loss of calcium and phosphate from the bone, and that is going to decrease the bone mass. These all are the symptoms signs we will get in this microgravity situation. Now coming to some question part related to these topic. When an astronaut stay in a microgravity for a prolonged period of time, which of the following occur? ठीक है, माइक्रोग्रेविटी के बारे में, इंक्रीज इन बोन मास, इंक्रीज इन मैक्सिमम कार्डियक आउटपुट, इंक्रीज आरबीसी मास और डिक्रीज्ड ब्लड वॉल्यूम. When astronauts stay in a microgravity for a prolonged period of time, which of the following occur? Yeah, wait, to microgravity situation में क्या होगा, blood volume is going to decrease. Coming to next, nitrogen narcosis is caused due to nitrogen inhibit dismutase enzyme, increased production of nitrous oxide, increased solubility of nitrogen in nerve cell membrane, decrease oxygen free radical. Nitrogen and narcosis is caused due to. Nitrogen and narcosis is due to, because of nitrogen having higher affinity to the lipid containing membranes, that is our nerve cell membrane. That's why nitrogen and narcosis or nitrogen toxicity is there. Coming to the next one. Casson's disease is gas embolism, fat embolism, amniotic fluid embolism, or the tumor embolism. Casson's disease is Mm. Yeah, very true. It is our gas embolism. Coming to the next one, true about Casson's release, oxygen release from tissue, carbon set release from tissue, nitrogen release from tissue, or hydrogen release from tissue. True about the Casson's disease. Everybody answer this question fast. Yeah, wait. Nitrogen release from tissues is our Cassion's disease. Cassion's disease, pain in a joint because of nitrogen bubble, oxygen bubble, carbon monoxide, or air in joint. In Cassion's disease, pain in a joint is due to. Everybody answer this question. No. Nitrogen bubbles go and accumulate at the joint region, and that causes pain in that area, and that causes bending. Okay, so answer is only and only nitrogen bubble. Coming to the next one, a patient in a Sukhoi aircraft is experiencing a negative G. Which of the following physiological event will be manifest in such situation? Hydrostatic pressure in veins of lower limb is going to increase, cardiac output is going to decrease, blackout occurs, cerebral arterial pressure rises. A pilot in a Sukhoi aircraft is experiencing negative G. Which of the following physiological event will manifest in such a situation? Yeah, very true. As cerebral arterial pressure rises, cardiac output is going to increase, hydrostatic pressure is going in the veins, venous pulling is going to decrease, blood reaching to eye is going to increase, that is going to cause a red out effect. So answer is only and only T. Very good. Coming to the next one, decompression sickness is seen in diver, pilot, diver and pilot both, diver, pilot, mountaineer, diver, pilot, mountaineer, or astronaut. Decompression sickness is seen in. Decompression sickness is seen in decompression sickness हमारे डाइवर्स में सिर्फ मिलेगा, पायलट में कहाँ से मिलेगा? हाई एल्टीट्यूड में हमारा decompression sickness नहीं होता, माउंटेनर में नहीं होता, एस्ट्रोनॉट्स में नहीं होगा. Okay, answer is A only. Everybody is this clear? I guess this was the last question. Yeah, that was the last question. आज के session में किसी को कोई doubt? If anybody has any doubt regarding today's session, you can ask. Everybody, do reply fast. Is this topic clear with everybody? Hope you all like this session. If you like this session, do like and share. This is important. जितना ज़्यादा share करते हो, class उतनी interactive होती है. And subscribe our channel. That is Unacademy Live NEET PG. Most welcome everybody. Most welcome. Subscribe our channel. That is Unacademy Live NEET PG. And press the bell icon so that you will get notification of any classes on this page. So do subscribe our channel if you haven't subscribed it yet. Regular मेहनत करते रहिए, you will definitely able to achieve your target. You will definitely crack your exam with good rank. Do hard work. Your hard work will be definitely paid off. Do more and more MCQ. Do more and more revision. You will definitely able to achieve your target. You will definitely crack your exam with good rank. Thank you so much for joining. This is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this to get additional 10%. Okay, but do remember we are going with this unlock 20 जहाँ पे आप मेरे कोड को यूज करके additional 20% off avail कर सकते हो, and this is till 30th June. Okay, so do enroll yourself right now, everybody. Thank you so much. See you all in the next session. Bye bye, everyone.